Hey. Good morning, everyone. Thank you all so much for coming today in what is quite a windy and bleak day in Warrnambool anyway. So I hope you're warm and dry wherever you are. Thank you all for joining us today as we launch our sexual and reproductive health survey. My name is Caitlin, and alongside my colleague Alice, we will be hosting today's webinar. Behind the scenes, we're also joined by our colleague Hannah, who will be providing technical support throughout the webinar. So if you are experiencing any technical difficulties, you can message Hannah directly and she will do her best to support you throughout today. For those of you that are new to our organisation, Women's Health and Wellbeing Barwon Southwest is a feminist non-for-profit organisation committed to intersectionality, gender equality and best practice health promotion. We are the lead organisation for this work in our region, which extends from the Barwon to the South Australian border and covers 9 local government areas. We take a primary prevention approach and work across the priority areas of gendered violence, mental health, gender equality, women in a changing society, chronic disease and sexual and reproductive health. We are delighted to launch our sexual and reproductive health consultation survey snapshot today. This report is part of our consultation project that aims to identify the key barriers women and gender diverse people encounter when accessing sexual and reproductive health services, as well as the experiences of service providers who deliver these crucial services. Thank you so much for joining us today. We know there are a range of people on the webinar today who have been integral to both the development and the completion of this survey, including some who were pivotal in the design phase, many who were incredibly supportive in helping us promote and share the survey, and some of you may have also completed the survey yourself. There also may be some joining us today who are just interested to hear the results of the survey. Whatever capacity you're joining us in today, we're incredibly grateful for your time and value your attendance. As we begin today's events, I would like to acknowledge the traditional owners of the land upon which we're meeting on today. For Alice and I, we're joining on the lands of the Peekarong people of the Gunditjmara Nation, and Hannah is joining us from Wadawurrung country. I acknowledge all Aboriginal and Torres Strait Islander people's resilience, their cultural heritage, their continuing connection to land, waters, community across Victoria and Australia. I pay my respect to elders past and present, and I extend that acknowledgement to any Aboriginal and Torres Strait Islander people who may be joining us today. Before we kick off into the session, I'd just like to do some light housekeeping and a bit of a touch base on some of the language that we'll be using today. So we are recording today's webinar and it'll be posted on our website for anyone who can't make it today. This is a Zoom webinar and only the speakers are visible and participants' names or faces will not be recorded. Zoom has a live captioning function, which we have turned on for everyone. To turn it off, click the CC icon and deselect the show subtitle. Please use the Q&A function for questions or to share any thoughts and comments. This will be moderated by Hannah. Unfortunately, we don't have time in today's agenda to allow for a Q&A session. However, we will collate any questions we receive and try our best to respond and follow up via email. Looking at the language they're going to be using today, we'll be referencing the Barwon Southwest region. So all information presented today has been collected from women and gender diverse people and services located in the Barwon Southwest. And the Barwon Southwest region refers to the area of Victoria that you can see on the map on the screen. This spans the 3 traditional owner groups of the Gunditjmara, Eastern Ma and Wadawurrung clans, as well as the 9 local government areas you can see there. Sexual and reproductive health care refers to a broad range of services and information across the life course. When we talk about sexual and reproductive health today, we're referring to the broad range of services that you can see on the screen, including contraception, abortion, which is both medical and surgical, maternal and perinatal health, sexually transmitted infections, chronic conditions such as endometriosis or polycystic ovarian syndrome, and education. Our definition of women encompasses both cisgender and transgender women. So when we refer to the word women throughout today, we're referring to all those that identify as women. Women's Health and Wellbeing Barwon Southwest is pro-choice, and we believe that every person has the right to reproductive and bodily autonomy. All information presented today, so all the quotes and data, has been de-identified and is kept confidential. And we would like this space to be respectful and safe for all participants. We ask everyone treat each other with respect and share any thoughts or questions with kindness and consideration. And finally, just a note on safety. If you feel impacted by today's discussion, please feel free to take a break or do whatever you need to do to look after yourself. We know that our sexual and reproductive health is linked with having safe and sexual relationships. So if you'd like to speak to someone about violence you have experienced, Hannah will kindly put some numbers in the chat, but please make sure to practice self-care. Thank you, Hannah. And I will now hand over to Alice.
Beautiful. Thank you so much, Caitlin. Hi, everyone. I'm Alice. I use she, her pronouns, and I'm also a health promotion officer at Women's Health and Wellbeing. I've had the pleasure of co-leading this consultation project with Caitlin, alongside our amazing team leader, Jacinta, and many other colleagues. As Caitlin mentioned, we're really thrilled to have you join us today as we launch the snapshot of our sexual and reproductive health survey. The project was established in early 2025, following recommendations from the Mapping Access to Sexual and Reproductive Health Services in regional Victoria, which Sarah from Deakin will speak to a bit later. The project has used a mixed method consultation approach in this project, which includes surveys, focus groups, and interviews. We're thrilled to be wrapping up the first half of the consultation project, which was distributed via 2 surveys to the community and the sexual and reproductive workforce in the Barwon Southwest. After a very detailed and thorough analysis of 461 responses to both the surveys, we are delighted to present the snapshot findings with you all today. Phase 2 will launch in October, and we'll share more about that later in the webinar. So to today's webinar, we have a fantastic lineup of speakers, which includes Jodie Hill, Women's Health and Wellbeing Barwon Southwest CEO, for some opening remarks. Sarah Wood from Deakin University will share key findings from the Mapping Access report released in 2024. Caitlin will share an overview of the community survey, including key statistics and findings. I'll share a brief overview of the service provider survey, which includes barriers for service delivery and observations about patient and community experiences. And lastly, we'll provide information about next steps of the project and how you can get involved. I'm now delighted to introduce our opening speaker, Jodie Hill. Jodie, as I mentioned, is Women's Health and Wellbeing Barwon Southwest CEO and a staunch advocate for women and gender diverse people in our region. She's been instrumental in promoting this piece of work across the Barwon Southwest. I think, Jodie, you were on almost every radio station for a while there, so we're really thrilled you can join us today. Thanks, Jodie, over to you.
Thank you, Alice, for that introduction, and thank you to the team for the amazing work that's gone into this. I'd like to welcome everybody that's joined us today. Thank you for your interest in this very important work, and also thank you for your participation. As CEO of Women's Health and Wellbeing Barwon Southwest, I can't tell you how proud I am of the very good work that the team have put into this. Ensuring access to comprehensive sexual and reproductive health services upholds the dignity, rights and wellbeing of women and gender diverse people. When people have control over their sexuality and reproduction and have opportunity to optimise their sexual and reproductive health, they can better participate in all social, economic and political opportunities that present to them. It's widely recognised that women's health has historically been under-resourced and under-prioritised within the medical system. We also know that rural and regional women, girls and people face greater barriers to accessing essential SRH services, including distance from healthcare facilities, limited transport options, restricted operating hours, high costs of services, limited availability of trained medical professionals, and difficulties in achieving confidentiality. We're really delighted to be shining a light on the sexual and reproductive health issues that women and gender diverse people experience in order to better identify and better understand the challenges that are faced, and most importantly, to contribute to moving forward with improvements and solutions. Investing in a range of sexual and reproductive health services that fully meet the needs of all people is known to have multiple health and social and economic benefits, including a significant decrease in unintended pregnancies, unsafe abortions, maternal deaths, and a reduction in the number of people living in chronic pain. Here at Women's Health and Wellbeing Barwon Southwest, we strive towards an ambitious vision for change where women are healthy, safe, and equal. Ensuring all people can equitably access sexual and reproductive health care is a big part of that vision. This consultation is a critical step in understanding the barriers that exist so that we can help address them and so that we can inform decision makers about necessary actions. We can't do this work alone. Success relies on us listening to people with lived experience and collaborating with frontline organisations and service providers. We're eternally grateful to the over 400 community members and service providers who completed the survey and who shared your experiences with us. Your voices are invaluable, and as we move forward in addressing the barriers and creating a region where women's sexual and reproductive health is valued and prioritised. So with that, I'll hand back to Alice to move on with the rest of the presentation, but thank you all for joining again.
Beautiful. Thank you so much, Jodie. Really appreciate your words and your leadership to improve women and gender diverse people's health in our region. We'll now move on to our second speaker. I'm also thrilled to welcome Sarah Wood, Associate Research Fellow at Deakin Rural Health and the Centre for Australian Research into Access. Sarah is the leading author and researcher on the Mapping Access report, and we're delighted that she can join us today. Sarah is also one of the founding members of our Barwon Southwest Sexual and Reproductive Health Community of Practice. So yeah, we're really wonderful to have you here today. Thank you, Sarah. Over to you.
Thank you. Thanks for the intro. Hello, everyone. So today I'm here to provide a brief overview of the project that we undertook to examine access to sexual and reproductive health services in the Barwon Southwest. So the first part of this project was a systematic review of the peer-reviewed literature to understand the evidence on the barriers and the facilitators to women's access to sexual and reproductive health services in the rural Australian context. So when we're talking about access to healthcare, there's numerous factors that influence access, and they can generally be described as geographic barriers and non-geographic barriers. And what we mean by that is the geographic barriers might be how far someone has to travel for care, and the non-geographic barriers might be the affordability of the care. So when we looked at the literature, we examined 50 articles, and a lot of the barriers that were reported, the geographic barriers, were limited availability of services and providers. And this was particularly around access to female GPs and Aboriginal health practitioners. There were transportation issues and increased travel. So that was around public transport to services and, of course, long travel times to access care. There were rural workforce challenges, and this was access to midwives and GP OBGYNs. When we looked at the non-geographic barriers, there was limited awareness of services, particularly around abortion services. There was reports of fragmented healthcare pathways, difficulties in navigating the health system, negative provider attitudes, particularly around abortion, stigma, and financial burdens. And the financial burdens were really around having to travel long distances for care and the additional costs that come with that. The second part of the project was the spatial mapping and analysis of the Barwon Southwest region to identify sexual and reproductive health service, the services and also the service gaps. So what we did was calculate travel times along the road network from every address point in the Barwon Southwest to the nearest service location. So this is really the starting point of understanding access. And what we mean by that is physical services need to exist and we need to know where they are before we can start to consider the other aspects of access. So we looked at a number of different sexual and reproductive health services, but today I'm just going to share a couple of screenshots of a few of those services. So what you can see on the screen is an interactive platform that I've recently developed that shows the service locations and the travel times from each address point in the region to the nearest service. So this one's contraceptive IUD, and it's the average travel time someone would need to travel to access that service. So when we aggregated this by each of the LGAs, the longest travel times that we identified were around the Glenelg Shire region. So the second image here is access to medical abortion services. And again, when we aggregated across the LGAs, some of the longest travel times were around the Southern Grampians region and the Glenelg Shire region. We found that there were some areas in the region that residents would need to travel over 115 minutes to access a service. And it's worth noting that whilst someone can physically travel to the service, there may still be other barriers to overcome. So for instance, they might be able to get to the service, but there may not be availability or the service may not be taking on new patients. These are publicly listed services, and as we found in the systematic review, some providers are reluctant to publicly list due to the stigma associated with offering these services. So from this preliminary work, we developed a really good understanding of where the services are, where the gaps are, and the evidence around the access barriers and facilitators that might be able to inform strategies at the local level. So whilst we developed all of that knowledge, the next step was really understanding the local context. So some of the recommendations that came out of this was to go out to the community and understand the experiences of our community and any barriers that they are facing to access services. It was also important to consult with healthcare providers to identify future capacity building needs for the region. So Women's Health and Wellbeing Barwon Southwest have done an incredible job of actioning these recommendations and conducting this consultation. So I've been in the data for so long, but I'm really looking forward to hearing the findings from the consultation, which may be able to provide further context around service access in the Barwon Southwest region. Thank you.
Beautiful. Thank you so much, Sarah, for that fantastic presentation. And Hannah will be pasting a copy of the link to those reports in the chat there. For those that haven't read the report, I highly recommend you taking a look at it. It's really fascinating research. Yeah, and a big thank you to Sarah for your pioneering work on this work. It just so clearly paints the access challenges that so many women and gender diverse people in our region face. So a big thank you to Sarah. We'd also like to thank and acknowledge the leadership of our team leader, Jacinta Lenahan, who was a co-author on this project and also has been a real champion in the sexual and reproductive health space. So this mapping project that Sarah's spoken about beautifully segues into the next part of our webinar today, which is exploring the findings of our sexual and reproductive health consultation survey. We have heavily been guided by the results of both the literature review and the mapping that Sarah spoke about, and this consultation is a continuation of the research and does action the recommendations that Sarah spoke about. So the survey was the phase one of the consultation project, and this survey aimed to capture the broad population data looking at sexual and reproductive health care and knowledge across the lifespan. And we disseminated two anonymous online surveys. So one was a community survey exploring people's experience experiences accessing sexual and reproductive health care. And the second survey was one for service providers and exploring their experiences delivering sexual and reproductive health care. The surveys were promoted via email, social media, radio, print media, and posters over a 4-week period. And both of the surveys explored the geographical and non-geographical barriers that Sarah spoke about in her presentation. In the community survey, we asked participants to either agree or disagree with a set of statements that revolved around those geographical and non-geographical barriers. And those statements included things like, I could access the service when I needed it, the service was affordable, the service met my cultural and language needs, the service was inclusive of my sexuality, and you'll see some of those statements in the findings today. So this webinar, is now, sorry, Hannah, if we'll go back to the next slide, sorry. Yep, so this, the snapshot report is now available on our website, and we'll also be sending you a copy via email following the webinar. Before I just delve into the results, I'd really like to acknowledge Kathy Valley, who is joining us today and was absolutely incredible in helping us analyse all the survey data. So thank you, Kathy, and we're delighted to have you here. We did get a lot of survey completions. We had 366 community members respond to the survey, and 344 of those responses were included in the analysis. Majority of respondents resided in the Warrnambool or Geelong area. I guess this wasn't surprising given both of these local government areas have the largest population size. 35% of respondents were aged 25 to 34, and this was the biggest age cohort in the survey. And again, probably not surprising given that this is a primary reproductive age for women and likely when they'll be going to engage in reproductive services. Survey respondents were a relatively homogenous group with 96% identifying as Caucasian, 81% identifying as heterosexual, and 84% identifying as not having a disability. Phase 2 of the consultation, which we'll speak about in a little bit more detail later, we will make a concerted effort to be able to engage with these population groups that were underrepresented in the survey. Next slide, thanks, Han. So we asked our respondents broad questions around health literacy and specifically seeking to understand where people get their sexual and reproductive health information, their knowledge of sexual and reproductive health services, and also their knowledge of certain sexual and reproductive health conditions. So the majority of respondents were seeking information, their sexual and reproductive health information from GPs, Google, or friends and family. And GPs was the top source of information across all age groups. The survey also identified that there's some areas of sexual and reproductive health where there's quite low knowledge. So we can see here that just 18% of survey respondents said that they had good knowledge of perimenopause and menopause. And we can also see that just 32% know where to access support for menopause. So we can see that combined low knowledge with also poor knowledge of where to access support signifies that that's an area of need. Conversely, there was also some really positive results here that we saw 75% of respondents had good knowledge of contraception. And we can also see that 80% know where to access long-acting reversible contraception. And that includes things like the Implanon or an IUD. And just finally, the last dot point at the bottom there is just 40% know where to access a medical termination of pregnancy, signifying that that's possibly also an area of need. So in the survey, we asked respondents about 5 key areas of sexual and reproductive health care, and they included contraception, sexually transmitted infections, abortion, chronic conditions, and then pre and post-pregnancy care. In this webinar, we'll just be exploring 3 key themes. So I'll be focusing on the areas of contraception, chronic conditions, and pre and post pregnancy care, but you can refer to our snapshot summary for details of the other areas. So looking at contraception, we found some interesting results and saw that 53% are currently using contraception, and the most common form of contraception is the IUD. However, there were some, I guess, concerning results as well that we can see. Just 37% agree that they were offered information and support for pain management, and just over half, 54%, agreed that the service was affordable. A really common sentiment experienced by respondents was that they had painful experiences with both IUD insertion and removal, and that they weren't provided with adequate pain relief or sometimes any pain relief at all. Many also spoke about lengthy waiting times in the public health system and needing to access care through private practice and seeking specialist care. This is obviously quite costly. And I think this quote down the bottom here really speaks to both the cost that women need to take to gain contraception, both in terms of the financial cost, but the cost of time as well. So one respondent said, I had 2 visits to 2 different women's health specialists and 2 attempts to have an IUD inserted. Each attempt included 2 visits, an initial consultation, and the insertion attempt. This was 30 minutes from my home. And again, that speaks to both the financial cost, time cost, but also the emotional toll that it can take on women seeking this care. Right. We move to pre and post pregnancy care. There were some really positive results in this area of the survey, in that we can see there was good access to certain services for pregnancy care. We can see that 95% of respondents were able to access maternal and child health services in their area, and also that 92% were able to access a GP in their local area when they needed it. Some other positive results also included that 83% of respondents agreed that they were able to maintain privacy, and 81% agreed that they were able to trust their practitioner. So it's lovely to see that there were some that had really positive relationships with their sexual and reproductive healthcare providers. We also gave respondents the option to respond via open text, and asked what were some of the other barriers that they experienced and also what would be helpful for them. And in those open text questions, 5 key themes emerged from respondents, which included limited access to services, limited mental health support, poor access to women's physiotherapy, the cost and use of private healthcare, and the need for more comprehensive care and greater continuity of care. If we focus on limited access first, I think the quote in the bottom right hand of the corner really speaks to that. So a respondent said, where I live in Hamilton, there are no specialist obstetricians. You need to travel over an hour away to Warrnambool, which is where I had to travel for my pre and postnatal checks. So that respondent lived in the area of Southern Grampians. And then we also saw similar sentiments from respondents who were located in the local government area of Glenelg, which were needing to travel over an hour to access care pre and post the birth of a baby. And if we look at the limited mental health support and the poor access to women's physiotherapy, the 2 remaining quotes, the one in the right-hand corner and the one in the bottom left, again speak to those issues, where we had one respondent state, I experienced a long wait for postnatal mental health issues after a traumatic birth experience. I had to repeatedly ask for assistance, and only when things were very bad, I was offered the assistance that was needed. And the quote in the bottom left, I did seek mental health and pelvic floor physiotherapy externally and privately, and would not have survived without either. Both of these need to be universal in the care of birthing people when a baby is born. Looking at both of those quotes, that was, another, sentiment that came through quite strongly, that respondents that were seeking either women's physiotherapy support or mental health support had a lot of difficulty accessing both of those supports in the public health system. Either they were met with really lengthy waiting times and weren't able to get the care when they needed it, or there just wasn't any care options available at all. So that's when women sought care through the private or public, through the private system and through their own private healthcare. However, we also know that that comes with a considerable cost for some and is not available to all. The other concerns that were raised were the need for more comprehensive support and greater continuity of care. So better support within the referral pathways, but also better connection between the service providers. And in terms of more comprehensive support, women were really seeking more support early in the early phases of post-birth delivery, and also more comprehensive support setting, like greater visits and greater home visits as well. And the final area in this section is chronic conditions. So we asked respondents if they had experienced a range of chronic conditions such as polycystic ovarian syndrome, endometriosis, chronic pain, difficulty with menopause symptoms. And we found that severe menstrual pain and heavy bleeding was the most common reported issue, with 46% of respondents reporting this. Endometriosis and pelvic pain were also common reported conditions and garnered a similar response rate, with about 35% and 37% respectively reporting this issue. There are also some areas of concern or areas of interest for us, with just 40% agreed that the service was affordable and just 42% agreed that they were able to access the service when they needed it. Again, we had an open text question in this area, and the comments that we received from that open text question fell into a couple of key categories, which included that respondents felt dismissed and that their pain was either minimised or dismissed. There was poor access, which included long wait times and long travel as well. That contraception was, kind of pushed as a solution for chronic reproductive conditions with little investigation. Poor system coordination and referrals. Limited information and knowledge from service providers, and also the cost. The overall summary is that women feel as though that their pain is being dismissed and minimised. They're unable to seek help or get answers from their regular healthcare provider, and that they're often having to endure years of pain and discomfort. And I think some of these quotes really point to, that frustration of not being able to seek answers, to feel heard, and to be given the care that they need. If we look at the quote in the top right-hand corner there, if the respondent said, if the GP listened to what I was saying, it would be a better experience. I want to be heard. I want to be included in decisions. I want to be believed. I don't want to feel like I have to kick and shout and or exaggerate to get a response from medicos. My pain and symptoms are real. How dare someone else tell me that I have it wrong? Another quote that really stood out to me was the one in the bottom left corner, where respondents commented, some actual support beyond an ultrasound. I know that I have polycystic ovarian syndrome, but its effects have never been explained to me, only brushed off. And that was quite a common sentiment, that respondents felt as though they weren't really given the information they need to be able to really effectively manage their conditions, and that their pain or the symptoms were really dismissed. Another common sentiment is that the care that they received from their general practitioner wasn't specialist, or that their practitioner didn't lack the knowledge that they needed, and that they have to seek care from, again, a private healthcare provider, which not every person has access to private healthcare and is associated with significant costs. Next slide, Hannah. Thank you. Final question in the survey asked respondents what support they would like to see in the community, but also from their healthcare provider. And there's a range of themes that came out, which you'll be able to see more detail in the snapshot summary. But a couple that I'll touch on here is that there was a really key theme and need for more information around perimenopause and menopause. And that includes information around where to access help, what perimenopause and menopause is, but also a greater need for access to affordable medications, specifically greater access to hormone replacement therapy. Respondents were also seeking better pain management for chronic conditions, but also contraception, insertion and removal as well. And again, that speaks to the need for greater care in the public health system and not just being able to seek that care from private practice. Women were seeking more comprehensive care and greater continuity of care in the pre and post-pregnancy space, and specifically looking for more care related to women's physiotherapy and mental health support. Again, that's available in the public health system. And finally, respondents were seeking affordable and available local healthcare. So respondents want healthcare that is close to home and that is affordable. Care that is available in the public health system that doesn't come with months-long waiting lists. I am now going to hand over to Alice, who is going to take us through the results from the service provider survey. Thanks, Alice.
Beautiful. Thank you so much, Caitlin. You and I have been in the data a lot for the community survey, but it's always really refreshing and a good reminder of some of these the responses that came through and the impact they can have on community members and people. Those quotes were quite powerful, so thank you. So we'll now turn to the service provider survey, where we heard from 96 sexual and reproductive health practitioners across the Barwon Southwest. We were thrilled with that amount. We know that these are very busy people, so thank you so much for those who filled out our survey. We know that sexual and reproductive health practitioners are skilled, passionate, and dedicated to their work. However, issues such as locally available training, demanding schedules, sometimes resistance from community, and appropriate funding can be barriers to delivering quality sexual and reproductive health care. So the survey was open to anyone working in sexual and reproductive healthcare. This includes primary care clinicians like GPs and nurses, allied health practitioners like physiotherapists, and public health staff and sexual health education officers. So as you can see on screen, nurses are the largest survey group. So thank you so much to all the nurses who filled out the survey and to everyone else. But we also heard from a really varied mix of providers from clinical and non-clinical backgrounds, which I think is fantastic, as this represents the diversity of the sexual and reproductive health workforce. So you can see on screen there, GPs were the second largest response group. We also heard from lots of support workers, midwives, and physiotherapists. And that other block there in black was nurse practitioners and women's health physio staff as well. So just to note that. We had significant geographic diversity as well from the service provider respondents, with a solid mix from all 9 local government areas in the Barwon Southwest, which is great. No surprises, we did have the highest response rates from Warrnambool and Geelong, which, as Caitlin mentioned earlier, are our 2 biggest geographic areas in the Barwon Southwest. So that makes sense. The survey asked practitioners about their experiences delivering or referring service users to 5 key sexual reproductive health services. And just to note on language, when we say delivering, that is regarding clinical staff, and non-clinical staff are those referring. So just when you hear me speak to that, that's that difference there. And so we ask these practitioners about what exactly are the barriers that prevent them from providing holistic care. So today we only have time to focus on 3 key areas, which is STI testing and treatment, abortion care, and chronic conditions. But the other areas are unpacked in our survey report, which we'll be able to share with you later today. I will flag as well, we are running ahead of schedule, which is a real delight. So we do potentially have time for a question or two. So just encourage you, if you have anything that's popped up and you have any questions for Caitlin or I, you have the Q&A function on your Zoom screen there. So Hannah will be able to review those and provide them to us. So we might have time for 1 or 2. We'll see how we go, but just wanted to flag that we do have some extra time up our sleeve at this stage. So let's jump in and have a look at STIs. So we heard from 24 clinicians and 12 non-clinicians who provide or refer for STI testing and treatment. There was some promising news. 81% reported they're aware of the relevant support services, so how they can refer their patients and communities related to STI testing and treatment, and find that referral process easy. 74 practitioners are able to remain up to date about current STI practices, which is great. That's filtering through from some of the national guidelines down to the practice level. So I think that's a really promising statistic. We also asked practitioners what would make it easier for them to provide or refer to STI services, and 3 key themes emerged, which were having a separate and private area to deliver STI testing and treatment. Of course, it's a very sensitive conversation to have with people. So yeah, that came through quite strongly. We also heard that adopting a nurse-led screening service would support the provision of STI care, and greater flexibility to offer after-hours and drop-in service care for STI testing and treatment, both to offer flexibility to practitioners but also to community. We also asked what some of the biggest barriers for practitioners, patients, and the community they work with, and what they experience when trying to access STI testing and treatment. And 3 key themes came through. The strongest one, which broke my heart a little, was that shame and stigma still is a big barrier for people, especially young people, accessing STI testing and treatment, and also people not knowing when and how often they need to get tested. Practitioners also reported there was long wait lists for appointment to see GPs as a barrier for community, and perceived or actual costs associated with aftercare and medication. And I think you can see on screen there some of the quotes speak to this particular challenge that presents itself for STI access for testing and treatment for young people, but also, excuse me, for people accessing this care outside of Warrnambool, so some of the bigger geographic regions in our area. So now move to surgical and medical termination of pregnancy. Can I have a quick drink? Sorry. Sorry, too much talking today. So yes, as I mentioned, we asked about the provision of abortion care, both surgical and medical. We received 19 responses for people who provide abortion care, and 6 of this group provide both medical and surgical abortion services, which is really promising, I think, to hear from that many people. And we also had 7 survey respondents refer for abortion services. So you can see some key insights there on the screen. 40% of clinicians said that public stigma and backlash was a barrier to providing abortion services. This is I think a bit expected for us. We thought that might have been a bit higher, as research often points to this being a barrier to the provision of abortion care, especially in regional Australia and regional Victoria. We also found that 48% of non-clinicians, so that's the prevention officers and support workers, folks like that, so that they're aware of support services and can refer easily. So while this is a fair number, I think it shows there's an opportunity here to increase awareness of available services, as we would probably like that number to be a bit higher. Another curious theme that came through was that some clinicians reported a low need from patients prevents them from offering abortion services. So this was a surprising theme for us, and something we'd like to unpack and explore a bit more in the next phase of the consultation through our focus groups and interviews. And lastly, this won't come as a surprise to many of you. Service providers report that confidentiality, travel times, and cost, especially cost for accessing abortion care, was a huge barrier for patients. We also heard from this report from Sarah earlier, so this is clearly a consistent theme for our area, and shows that these barriers are pervasive and significant. So I think this is pointing to some action for us in future. Lastly, I'll share some findings from when we asked about chronic conditions. So as Caitlin mentioned earlier, that's referring to polycystic ovarian syndrome, endometriosis, perimenopause, menopause. So we found 21 people responded who provide this kind of care, the service providers. In good news, 84% of clinicians are aware of support services for chronic conditions and can refer easily. So that's really promising that there's the awareness there. Sadly, however, just 19% of clinicians report that there is sufficient financial support for training to develop ultrasound skills for on-site services. So as the quote says on screen, there is a significant need for more funding, which is pointed out in that statistic previously, and that both patients and practitioners suggest more education and need more education about chronic reproductive conditions. For too long, as I'm sure many of you watching would know, for too long these conditions have been hidden and not spoken about. And I think we're really seeing the impact of this silence now, both in our report, but just broadly, I think, in conversations about chronic reproductive care. I also just want to recognise there's many incredible practitioners working in this space, some of whom helped design the survey. So thank you for all of your incredible work. And yeah, we can see the change we're trying to make in the region. Some clinicians also report the need for more resourcing for gender affirming and gender dysphoria care, such as clinics that support people of transgender experience. We know that services in our region for LGBTIQA+ healthcare are very limited. So this theme points to a need for better resourcing in this crucial area of reproductive care. So similar to the community survey, we asked service providers what they would like to see, to kind of giving them the space to be able to speak to what kind of support they would like, both for their own delivery, but also for community access for the patients and users they work with. So 4 key areas emerged, which includes a clearer referral pathway. So who is doing what, where, and how across the sexual reproductive health sector in the Barwon Southwest. So that's a big task, trying to map all of those services, but I think that it really came through. People want to be able to refer, they just don't know how to or who to. Service providers also recommended more comprehensive and targeted community sexual and reproductive health education to increase the patient health literacy and knowledge of when and where to access care. So that's coming through as a theme as well. And Caitlin mentioned this earlier. As I said, there's a strong need for more community health literacy in relation to menopause and perimenopause. So I think it's nice that this is being reinforced by both groups that we spoke to. People want to know more about the signs and symptoms of when to seek help. We also heard people want more place-based, affordable and flexible training opportunities, especially in relation to working with diverse patient groups and IUD insertion. Travelling to Geelong and Melbourne is a big drive if you're coming from some of the more remote areas of our region. And it's not always possible to either close the clinic for a day or even up to a week if you need to travel for this training. So having training that is in clinic or place-based came through as a strong theme that would support these service providers. And lastly, the theme that came through and is kind of close to my heart as someone who works closely in the community of practice that we run at Women's Health is the need for more workforce connection. So we heard that these practitioners are people who are passionate, but this work can also be isolating and succession planning can be a challenge. And this is especially true for people who are either the sole sexual and reproductive health practitioner or working in regional and remote areas. 44% of respondents said they feel connected to others in the sector. So while this is promising, I think there's certainly more room to provide more wraparound support for these people doing such amazing work. So while we have another round of consultation coming up, which we'll speak to in a minute, I think we're getting a really comprehensive picture of what the sexual and reproductive healthcare workforce needs and how women's health and wellbeing Barwon Southwest and other stakeholders can play a role. So that concludes the service provider summary, as well as the summary from Caitlin previously for the community survey. So as we wrap up the webinar today, I think we're actually on track. So we might possibly hold questions. So sorry for that sneaky promise earlier. But we, as we mentioned at the start, we are gathering any questions that come through. So we will be able to respond after the webinar. So we'll move now, if it's all right, hand to the next slide. We'll just share with you a bit more about what's coming up next for the consultation. So we are, of course, wrapping up the survey. So the report will be live on our website now, I think, which is exciting. So we encourage you to visit our website and view those results in our snapshot. So you can see there phase 2 includes focus groups and interviews. So this will be both online and in person for us to gain deeper perspectives and also ideas of how to improve sexual and reproductive health access. As Caitlin mentioned earlier, we really want to speak with people in communities who have unique barriers when accessing sexual reproductive health services, either due to gender, sexuality, or culture, as these were people who were unrepresented in our survey, given we were having that whole of population consultation. So we know this work needs to be done in partnership with organisations that work closely with community. So we hope to work in collaboration with local services to deliver these interviews and focus groups. So we were thrilled by the response to the surveys. As I said, we had 461, I think it was. So we're really blown away by the generosity of everyone. And we'd really encourage you to reach out, to be involved in these focus groups and interviews, to share your story. It's a really genuine way to be involved in solutions to create change in our region. And I think Hannah's going to put the link in the chat now. If you'd like to sign up, you can put your name and contact details there to be part of the expression of interest. So in terms of next steps, as I said, the focus groups and interviews will be coming over the next couple of months. And then by the end of 2025, we hope to produce a final report, which will summarise the survey, focus groups and interview findings. It will also include a series of recommendations and a path forward for our region, as we as a collective strive to improve sexual and reproductive health access and outcomes in our region. And over to you, Caitlin, to wrap us up for the day.
Beautiful. Thanks so much, Alice. That brings us to the end of today's session. We've just got a couple of, I guess, ways that you're able to further engage with our organisation, further engage in the work, and also to be able to continue this conversation. So our summary report of the survey snapshot, is currently live on our website. So you're very welcome to go down and download a copy from the website. We'll also send a follow-up email the next days following the webinar, which will include a copy of the survey snapshot, which you're very welcome to share with anyone that you think may be interested. We will also have an easy read version of the survey summary and also an accessible version of the survey summary on our website by the end of today as well. As Alice has said, we have these upcoming interviews and focus groups, and these are really an opportunity to delve deeper into some of the barriers, challenges that were identified in the survey, and to further explore what is needed in our community, in the service system, to be able to overcome and address these barriers. So if you have an interest, or if you have any thoughts or ideas, or if you'd like to share your story and experience, we'd love to hear from you. And please feel free to complete that expression of interest form that Hannah has put in the chat there. We realised today that we have just whizzed through these survey results, and there is some really rich data, some really rich stories. Respondents have been incredibly generous in sharing some of their stories, and some of the quotes really speak to sort of, I guess, the challenges and the heartache in this area. So we've just kind of skimmed the surface today. So if you are interested in wanting to know more around a particular area or just the survey results, more deeper in general, we're very happy to come and speak to you about these. So please feel free to get in touch with Alice or I or our team leader, Jacinta Lenahan, following today. And we're very happy to make a time and to come and discuss them with you further. We also have a couple of offerings as part of our learning series here at Women's Health and Wellbeing. And isn't it timely that menopause and perimenopause was identified as an issue where women are needing more support and wanting more information? And we just so happen to have a couple of webinars that will help address that and webinars for you. So the first webinar is on the 28th of July, and this one is titled Menopause at Work, Leading with Awareness, Compassion and Action. And this is targeted for HR professionals, managers and team leaders. And it's to learn about what menopause is, how it affects performance and well-being, and how workplaces can take meaningful steps to be menopause informed. And then the next webinar is on the 4th of August, and that is titled Thrive Through Menopause, Strategies for Women in the Workplace. And this one is for women who are experiencing the challenges of perimenopause and menopause. And it's an opportunity to learn practical tools to manage the lifestyle load for nervous system regulation, to improve sleep and emotional well-being. And both of those webinars are facilitated by Jo Circuit, who is a health educator and practitioner that we're really lucky to have facilitating those workshops. In our follow-up email, we will include the flyers to those webinars, so you'll be able to register easily. We also have a sexual and reproductive health community of practice, which Alice briefly mentioned. So Women's Health and Wellbeing Barwon Southwest hosts a community of practice for organisations working to support and advance sexual and reproductive health care among women, girls and gender diverse people in the Barwon Southwest region. The community of practice meets bi-monthly, and the purpose is to provide a space for connection, a space for collaboration, a space for shared learning, capacity building and knowledge generation. And we'd really just like to acknowledge those practitioners that are part of the community of practice. This community of practice has been instrumental in shaping this consultation project and are a group of fierce local advocates for improving sexual and reproductive health care locally. So I'd really like to thank and acknowledge those community practice members that are here today for your support, not only in shaping this consultation, but your support in advocating for the needs of women and gender diverse people across the region. That brings us to the end of today. So again, thank you very much for coming. We will be in touch with a follow-up email and some of the resources that we spoke about today. We thank you for the time you've taken to join us today. We thank you for your interest in this really important topic. We're incredibly grateful to each and every one of you for your support, your participation and your collaboration as we progress through this consultation project and work to raise the profile of sexual and reproductive healthcare in the Barwon Southwest. And if you go to the final slide, Hannah, you will be able to see our contact details there if you'd like to get in touch with us, or feel free to respond to Alice and I directly in our follow-up email. Thank you very much, everyone.